patients who come to my office and think they might have a rotator cuff tear will often tell me they have pain with lifting overhead, sometimes pain with reaching an extension. I've got patients who will often say, "Doc, I used to be able to lift, 15 pounds, and now I can't even get a jug of milk out of the refrigerator anymore." And those sorts of complaints are common for patients who do have rotator cuff tears. We'll do a thorough history and a very good examination. We usually will get some initial x-rays to make sure we're not missing anything alarming and to make sure that we don't have an arthritis process going on. As we go through the workup, patients who do have rotator cuff tears will often try conservative treatment first. This will often include physical therapy, sometimes oral medications or anti-inflammatory drugs, and or injections in and around the shoulder. Between those three, usually we can get rid of the inflammation. We can often rehabilitate patients and get them back to full recovery without having the need for surgical intervention. Conversely, we have plenty of patients who have larger tears, or what we call full thickness rotator cuff tears. Those are usually more problematic, they're usually more painful. Patients usually aren't able to rehab those successfully or as successfully. And oftentimes it impairs patients' abilities to work or do their job or do heavy lifting, or even simple tasks like driving and getting dressed. And so those are the patients that more often than not end up needing surgical intervention. Fortunately, we've been fixing rotator cuff tears for over 20 years now using minimally invasive techniques. And when a patient does become a good surgical candidate, it's usually after they've failed conservative treatment. And when we are ready for surgery, we can do it all through a minimally invasive approach using state-of-the-art technology, using small cameras where we can do it all with small incisions. I tell people they're keyhole size, 1 centimeter or less size incisions. And that really facilitates recovery, makes recovery a lot easier than it used to be with rotator cuffs. So often patients who are requiring rotator cuff surgery have heard from their friends or family members about how hard recovery can be after shoulder surgery in general. And it is true that there are no shortcuts when rehabbing rotator cuff surgery. And I will tell patients that the duration and the length of your recovery is often dependent on the size of the tear. Smaller tears will recover naturally faster than larger tears. As we go through the rehab process, there's usually 3 phases. We go through an immobilization phase where you'll be in a sling. Then we go through a range of motion phase where we work on getting all the stiffness out of the shoulder and getting all that motion back so people can lift overhead and behind their back again. And then eventually, as we progress, we get to the strengthening phase. And that's when we really start working on resistance training and getting people back to where they can perform high-level jobs that involves sometimes heavy lifting, construction work, things of that nature.